Welcome to the first ever podcast with Dr. Terry Fossum. My name is Sean Ford, the host, and we have Dr. Terry Fossum and Dr. Matt Miller. This podcast is designed to talk through the leading edge in veterinary medicine. Dr. Fossum has guests that are thought leaders in very specific areas of veterinary medicine. Thank you, Dr. Fossum.
Thank you, Sean. It's a pleasure to be here. And I'm very happy to introduce my guest today, Dr. Matt Miller. Matt is a board certified veterinary cardiologist. So we're going to talk about heart disease and the things that are really important to you today. So welcome, Dr. Miller.
Thank you.
And Dr. Miller, give us a little bit of your background.
So I did my veterinary training at The Ohio State University, undergrad, vet school, residency there. Once I finished, became board certified in cardiology, I moved to Texas A&M where I was on faculty for 26 years, and then moved to the Phoenix area, and now I'm a medical director at a large multi-specialty practice.
Awesome. So Matt, as a board certified cardiologist, tell people what that means. What was your training that makes you maybe different than the general practitioner that they would go in to talk to about their dog's heart disease?
So part of the training for to become a specialist in cardiology, sort of just to back up a little bit, once you're done with veterinary school, there's an internship, which is another year, and then your residency is another 3 years, with concentration obviously on the specialty in which you're interested. And so what we're trained in is not only the diagnosis, but the management of cardiac disease. We do some respiratory disease as well, but it's almost always concentrated on primary cardiac disease. And we do all animals, but basically all I do anymore is dogs and cats.
So, it's interesting, Matt, because I've dealt with a lot of physicians and they oftentimes seem to not know that dogs get heart disease. So explain to, I know that our pet owners know because they've had dogs with heart disease, but give us an overview of the types of heart disease that you commonly see in dogs.
So when we talk about heart disease, one thing we should probably get out of the way right off the bat is that dogs and cats don't have heart attacks like we think about with people. They don't get coronary disease. And so what we're really looking at is other forms of disease that involve one of the four major portions of the heart. And so when you think about the heart, we think about valves, we think about heart muscle, we think about the electrical system, and then we think about the sac around the heart of the pericardium. So when I see patients with cardiac disease, I usually separate them out into, of course, dogs and cats, because they get very different diseases. And even small dogs versus large dogs, are there specific breeds that get specific diseases? So the diseases we see most frequently are degenerative valve disease, where the valve just gets thickened and it starts to leak. We see diseases of the heart muscle, and some of those are heritable. Some of those are associated with nutrition. And then we do see electrical abnormalities as well. We have some dogs that their heart muscle's fine, their valves are fine, but they have very important arrhythmias, sometimes fatal arrhythmias. So there's a wide array of diseases that we see, and there are some very specific breed predispositions as well.
So let's break this down. So we have heart disease that we would call congenital, meaning the dogs are born with it. And some of those we can fix, right? And then we have acquired disease. So typically disease that valve disease that dogs get as they age. So we can surgically repair some of these congenital diseases. What are we doing for the dogs that have the acquired heart disease, where surgery is not an option?
So that field's actually changing a little bit. Most dogs with what we typically refer to as adult onset disease, because most of them probably are genetically predisposed to these diseases. Most of the time we're relegated to medical management. So drugs that will get rid of fluid or address rhythm abnormalities, or maybe make the muscle even function a little bit better, at least for a certain time. I think what's really important to recognize is that when we give patients medications, we're not really fixing anything, right? We're trying to manage their disease process. I think that's sometimes lost on people. Now, with the most common disease that we see by far and away in dogs is valve disease, there are interventional procedures that can be really helpful. So you can have the valve repaired, just like it would be if it was you or I. We can use catheter-based techniques to tighten the valve, if you will, or bring the valve leaflets closer together so they don't leak as badly. And then we can also do a procedure where we literally poke a hole inside the heart and give one of the chambers the opportunity to unload into a lower pressure chamber. So there are things that we can do when people are really motivated to prolong the symptom-free interval or diminish the likelihood that we're going to have complications. And even though I said we don't fix anything with medications, if we go back to that original intervention, the mitral valve repair, those dogs are essentially fixed. They come off almost all of their medications, and so that is an option. And there are dogs that lend themselves really well to that intervention. There's some that don't work at all.
So valve repair is often, it can be an open heart surgery, right? So that's not being done in very many places, as I understand it. Where if people were interested in that, who would they talk to?
So there's a group at the University of Florida that is doing open repair on cardiopulmonary bypass. The group that probably has the best success rate is in Japan. So if I was going to have my dog's valve repaired, I'd figure out a way to get them to Japan because their success rate is well above anybody else. They're reporting some new data at the ACVM meeting this year, and I've seen some preliminary data, and it is impressive. So if you have the wherewithal, you fly to Tokyo and get your dog repaired there.
And I've seen a bit of that data, Matt, and they're doing small dogs. I mean, like 2 and 4 pound dogs, right? So size is really not the limitation there. So that's really exciting. Yeah. So that's valve disease. But let's talk about something that has been in the news a lot, and I think people are really confused about. And that is, talk to us about dilated cardiomyopathy, what that is, and then talk to us about diet and how it might cause dilated cardiomyopathy, if it does.
Okay, that's a hard one. That's a can of worms.
Yeah.
So when we talk about dilated cardiomyopathy, let's take a step back. And what we're talking about is that the heart muscle, most of us think of it as simply a pump, and that's its major function. With dilated cardiomyopathy, what happens is that the heart muscle doesn't contract as vigorously as it used to. And most of the cases of dilated cardiomyopathy we see are heritable. There are specific breeds. Doberman Pinschers are a classic breed, Great Danes, some of the other giant breeds as well. Recently, and what I mean by recently is in the past 4 to 7 years, there's been a lot of interest in nutritionally associated dilated cardiomyopathy. And what really got people interested in that or recognizing that is we started to see very atypical breeds with classic changes. And people started looking into the nutrition in those dogs and found some correlations with the nutrition that they were receiving and their clinical disease. Now, if I could go back in time, what I would like to do is take away the grain-free moniker that was placed on that, because initially it was associated with grain-free diets. It's much, much more complex than that. There are some really smart people working on that. And there are diets that have been looked at closely. that are more likely to be associated with dilated cardiomyopathy, and we're not going to name names or anything like that. The FDA website lists the diets that at least have been reported to be associated with it. For those people that are really interested in looking at, hey, I want to make sure I'm feeding my dog the right food, there's the Wasava website, and we can link that in the show notes. Has a list of basically approved diets. And if people want to dig even deeper, especially for people who want to make a homemade diet for something and they just want to make sure that their dog is receiving something balanced, I would suggest that they go to the Tufts website. I believe it's vetnutrition.tufts.edu. But again, we'll link something to the show notes in there. The nutrition service at Tufts is, in my opinion, the best one in the country. And they have a very, very strong interest in cardiac disease. They've published widely in it. They have ongoing clinical trials in it. And so I would direct anybody that's really interested in that to that website.
Yep. Throw out a name. Dr. Lisa Freeman's there. She's amazing. So
absolutely,
yeah,
amazing.
Great person. So Matt, we understand dilated cardiomyopathy, the heart gets bigger and thinner and it doesn't pump anymore, and maybe that's diet related. What about supplements? What should people be doing other than diet? So let's say everybody should take a look at the diet and make sure they're feeding their dog something that's, hopefully not going to cause dilated cardiomyopathy. But what about all these other dogs that people have that are potentially could get heart disease? What supplements, ingredients, products should they be looking at for their dogs, and which dogs should they even be thinking about this?
So if a dog's on a really well-balanced diet, and again, we gave some resources for that, then supplementation is probably not universally necessary. But there are some breeds that are very highly predisposed to cardiac disease. Cavalier King Charles Spaniels, for example. Havanese is a phenomenal breed, but really highly predisposed. Small breed dogs that have murmurs. So there are a lot of dogs that have heart disease, but they don't have heart failure. So recognizing that they have heart disease, following them along closely, deciding whether or not they need medical management, dietary changes, or supplementation is really important. And that's just about any dog that's less than 20 pounds is at risk for developing valve disease. And it's a very, very common disease process. So if your dog has heart disease, most likely your veterinarian has said, your dog has a murmur. Even if your dog's asymptomatic, supplementation might be appropriate for your patient or your dog. It would be my patient, your dog. So one of the things that you have to be careful about is that there are a lot of supplements that are what we refer to as cardioactive. What I mean by that is some of the supplements will change heart rate, may promote rhythm abnormalities, may lead to diuresis, which means getting rid of fluid. And in an asymptomatic patient, we don't want to do that. We don't want to. If you had heart disease but you're asymptomatic, you wouldn't want something that changed your volume status or anything like that.
So, Matt, I'm going to interrupt you. So tell people what the symptoms are, because they may not know what to look for. So you say asymptomatic. Yep. What are the symptoms?
Okay, so most dogs and cats with heart disease will first show respiratory difficulty. Okay, that could either, in dogs, it's almost always cough. In cats, it's usually just shortness of breath. Cats are breathing faster and with more effort than normal. In dogs, it's usually cough. In some big dogs, it might be notable exercise intolerance. And in some, especially the ones we talked about arrhythmias, sometimes they pass out. They look like they just died right in front of you. And so typically what I say is cough, shortness of breath, exercise intolerance, collapse. Any of those should make you concerned about important heart disease.
Okay, awesome.
And we should probably also talk about the difference between heart disease and heart failure. Huge difference, okay? Not every dog or cat that develops heart disease goes on to heart failure. And so I would say I spend 30% of my clinic day decreasing or stopping cardiac medications because they were started in a concern for heart disease and heart failure when in fact it's just heart disease. And let's say, for example, with dogs with valve disease, the majority of dogs that develop valve disease, leak in their valve, never go into heart failure, especially if they're put on cardioprotective medications or administered supplements. So that's an important differentiation as well. So go ahead.
Talk to us about the cardiac supplements that these people should have their dogs on if their dogs are at risk.
Okay, so when we think about supplements, to me, I always think about it as if I want something cardioactive, that's going to be a medication under my care. Okay? So when I look at supplements, what I'm really looking at is I want to make sure that my patient has all of the nutritional substrates that are going to be required for appropriate cardiovascular function. Okay? So what I mean by that is I want to give them medications that will help their vessels open up if they need to. Make sure that their myocardium, their heart muscle, can convert their nutrients into energy and then contract. And so things like fish oil, coenzyme Q10, arginine, those are some of the things, carnitine, taurine, those are standard things that we want to make sure that our patients with heart disease have on board. And they're not always going to get that adequately from even a well-balanced diet because now their nutritional needs might be a little bit different. So those are the things that I would look for in a supplement, especially with a fish oil supplementation or an Arctic fish oil supplement.
Great. That's awesome. So anything else you would tell people that they should really be aware of if they have a dog that has maybe a predisposition to heart disease?
So there are specific breeds that are highly predisposed. Obviously, we mentioned a couple of them, Doberman Pinschers, Cavalier King Charles Spaniels, Havanese. What I would do is, one, I would be on the lookout for some of the clinical signs that we described: cough, shortness of breath, exercise intolerance, collapse. I would also, in partnership with my primary care veterinarian, always bring up the topic of cardiac disease. Most veterinarians are going to bring that up on their own. They're going to say, you realize your dog is at risk for development of heart disease. So we're going to make sure we're really concentrated on every time we get the opportunity to evaluate your dog. We're going to make sure we listen really closely because most of the time there's something on physical examination that gives us an inkling that they have disease. There are screening tests, blood tests that you can do that will give you some insight. We have to be a little bit careful about utilizing those because there can be false positives, which will send us down a diagnostic trail that could be expensive and not indicated. So careful physical examination is probably the best way to detect early cardiac disease. And that means your dog or your cat has to be seen by a talented clinician.
So you're not going to say this, so I will say this for you. If you're seeing a general practitioner and your dog has heart disease and it's possible to get referred to a veterinary cardiologist, do it because their training is very different and your dog will get better care is the bottom line. So Matt, let's say I'm a cat person. So we've talked a lot about dogs, just a little bit about cats. Tell me about heart disease in cats, and specifically tell me about, I see a lot on the news these days about athletes and hypertrophic cardiomyopathy, and I know that's a disease of cats. Tell us about that.
So cats get very different disease than dogs. Just like dogs get different disease in people, cats get different disease than dogs.
And I'm just going to say, we always say, Cats are not small dogs. So that's a veterinarian thing, but we do tend sometimes to treat cats like dogs, and they're not. They're very different.
They're very different. So almost without exception, cats, when they have adult onset disease, it's a disease of their heart muscle. But very different than the one we talked briefly about in dogs is that their heart muscle still contracts very well. The problem is it gets inappropriately thick. And when it gets inappropriately thick, it doesn't relax normally, it's stiffer, it's harder to fill, and they can go into congestive heart failure associated with that. And cats are unique in that they are very predisposed to clot formation as well. And so they can have clots that go to their back legs most commonly, but it can go to their brain or their heart or their kidneys or basically anywhere an artery goes, which is everywhere. So most cats will have an abnormality on their physical examination that prompts somebody to think about them having heart disease. So once again, routine evaluation with careful physical examination will oftentimes allow your veterinarian to say, hey, I think your cat might be at risk for heart disease or maybe even already has heart disease. And then they'll have to go on to other diagnostics to confirm it. Again, just because you get a diagnosis of heart disease does not mean your cat's going to die from heart disease. So heart disease, important heart disease, heart failure are very, very different things. There are breeds that are specifically predisposed to heart disease. Some of those breeds have known mutations, so you can do genetic testing. So for ragdolls, for example, Mancoons, for example, two breeds that are highly predisposed to cardiomyopathy, genetic screening is a reasonable thing to do. Even if you're not going to breed your cat, genetic screening will give you a pretty good idea of how highly predisposed your cat is to developing heart disease.
So tell people what that means. How do they get genetic screening done on their cat?
So there's a lot of places to get genetic screening, and there's a lot of, again, you always have to be a little bit careful, buyer beware of sending in a cheek swab or something like that to a company that says, well, we'll look at your cat's genome or something like that. What I always recommend is if you're going to get genetic testing for cardiac disease in your cat or your dog, you go to the source. And the source is North Carolina State University. The dean of that school discovered almost all of the major mutations that we know about for cardiac disease in both dogs and cats. They've been doing that genetic test for longer than anybody because they developed that. They discovered that mutation. And that's where I would send my sample. That's where I send all my samples of my patients.
Okay. And that's Dr. Kate Mears is the one who started that, yeah.
Yep. It's the cardiac genetics lab at North Carolina State University. You can Google it, very easy to find.
Awesome. So Matt, what else do people need to know about heart disease in either their dog or their cat?
Well, we covered a lot of the major diseases that we see. One of the things that is I think really important is just like for you and I, activity is important. So keep your cat thin, keep your dog thin, keep your cat active, keep your dog active. And some of that, comes down to keeping their joints as good as we can. Part of that, or a huge portion of that, is regular exercise.
Awesome. That's been great.
Yeah, so I Dr. Miller, I was actually curious as a dog owner myself, how prevalent are these conditions, from heart disease in cats and dogs? How often are we seeing this in the general dog and cat population? And then how for these predisposed breeds, how common is it in those breeds as well?
So that's a tough question because there's quite a bit of breed variation. But let's just take a Cavalier King Charles Spaniel, for example. Those dogs are almost certainly going to develop valvular heart disease. There are some breeders and some lines that have done a really good job of diminishing that disease in that breed. But I'm in a statistic I would quote to you is that it's been estimated that there's 7 million dogs in the United States that have heart disease. So it is very common. If you're in a busy general practice, I would argue that somebody's going to hear a murmur in at least one patient every week. So
Wow.
once you have a murmur, that tells you have heart disease. Now, really, really important to remember, and I think I stated it before, but it's good to state it again, is just because your veterinarian says your dog or your cat has a murmur, doesn't mean they're going to go into heart failure, doesn't mean they're going to succumb to heart disease, but it does mean we should probably get a little bit more data and figure out. And the reason I'm adamant about that is that we now have data that if we find valve disease or myocardial disease, especially in dogs, the data is not robust in cats, is that we can change the course of the disease.
Wow.
Okay? And so dogs with valve disease, dogs with what we call preclinical dilated cardiomyopathy, so that's no clinical signs, but diagnostic evidence that they have the disease, we can make them live longer, keep them symptom-free longer, and give them a longer total life. So really important to get that data up front.
Yeah, so almost prevention at this point if you start them early.
Yeah, so we use the term cardioprotection rather than prevention, primarily because what we're doing is we're trying to slow the progression of their disease, but we didn't prevent them from developing it. But we can make a big difference, especially in dogs. And again, we're getting back to what's the most common disease we see in dogs? Valve disease, by far and away. 30-fold more common than all the other diseases that we have. Okay, so we could talk a whole podcast on valve disease, or I could at least. And so that's the one we really want to concentrate on, and that's the one that we have the most robust data in. That if we find your dog at a certain time in their disease process, we can substantively change the course of their disease. We're not fixing them. Like we said, with medication, you don't fix anything, but we can make a big difference in how long your dog is symptom-free.
That actually raises a really interesting point. So if you have a dog if you have a dog that's at risk from a breed perspective, at what age would you go to a veterinary cardiologist to have the dog evaluated, even if your general practitioner doesn't recommend it? At what point in time would you say, I know that this is potentially an issue, I want to get my dog checked out to potentially get ahead of this?
So that's dependent on the disease. So say, for example, we'll get back to the most common disease that we've been talking about, which is valve disease. If you go in for routine evaluation, let's just say the dogs are going in twice a year for routine evaluation, and your veterinarian does a careful examination and does not hear a murmur, there's probably no reason to go see a cardiologist. Absolutely no reason. If your primary care veterinarian says your dog has a murmur, then it would be reasonable to do more diagnostics. And that might start out with just a chest x-ray, or for a lot of people, they say, well, I want to know exactly where we are, so I want to get an echocardiogram or ultrasound of the heart. I would go to a cardiologist for that. It's a little different in some of the other diseases because sometimes we don't have a really obvious murmur. And so you can have heart disease and it can be percolating there. You don't really know about it. And that's true in cats and that's true in dogs. So if you have a highly predisposed breed for, say, dilated cardiomyopathy in a dog, I'd be doing genetic testing. So boxer dogs, Doberman pinschers, we have genetic testing for both of those breeds. I would definitely, and you can do that at your first visit. A lot of really reputable breeders are now doing it in all of their breeding animals. So if mom and dad don't have the mutation, guess what? You don't have the mutation. But if they haven't been genetically tested, I would genetically test them, because that will help drive recommendations for screening tests. So I think the best way to look at or prevent progression of disease. Let's not say prevent progression of disease. To evaluate your patient is to get him in for good routine evaluation, careful physical examination. Veterinarians know, general practitioners are well aware of the breed predispositions, and they're going to listen. They always listen closely, but they're going to listen a little tiny bit closer in a Cavalier or a Havanese. They're going to listen a little bit more closely in a Doberman Pinscher, because if they even have one premature beat, that should probably get their attention, and your dog should probably be evaluated.
Awesome.
That's really interesting. And when you, if you were to buy or, go to a breeder to get a dog, would you request the genetic testing of the parents prior to taking possession of the dog? Or is that a consideration if you were to, get a new pup?
So we're talking specifically about cardiac disease. I would not buy a Doberman Pinscher unless I knew that both their mom and dad were negative. Okay, I wouldn't buy a boxer dog. Again, this is from a cardiac standpoint. Okay, these breeds have plenty of other issues which are outside my wheelhouse, but I'd request genetic testing on that, just because. I've seen enough dogs with really bad disease, and it is devastating for people to have a 6-year-old strapping Doberman Pinscher that now has dilated cardiomyopathy and is going to be dead in a year. A boxer dog, sometimes they just drop over dead. They look completely normal, and then they're not. So when there's genetic testing that can be utilized to determine risk and also drive breeding decisions, I think we should take advantage of that.
So that's for dilated cardiomyopathy. These small breeds, the Cavaliers, Havanese, is there any testing for those dogs?
There's not really any genetic testing that I'm aware of that's predictive. So plenty of people working on it. It's probably way more complex than the dilated cardiomyopathy. Not to dismiss the importance of what Dr. Mears and her team has done, but I'm unaware of any genetic testing that is predictive in those dogs.
Okay.